You're listening to Parents You've Got This, the expert guide to parenthood.
The complete guide to pregnancy, birth, baby and parenthood.
As a new parent, it can be quite overwhelming when it comes to the care of your baby's genitals. Well, we have our paediatrician expert, Dr. Lexi Frydenberg, back on the pod today to give us her tips and tricks for how to care for this area.
Dr. Lexi Frydenberg is an experienced general paediatrician working in both public and private practice. She works for a huge number of organisations. She does lots of media, so her name is probably very familiar to you all, and she comes to us today with the very best information and expert advice. Thank you so much, Lexi, for being with us today.
Thanks for having me.
Now, it's a funny thing when we're looking after a little baby because we feel like we should just know it all, but there's something about the care of genitals where we want to get it right, and particularly if we're female ourselves, we might not be so familiar with male private parts, and as it goes the other way as well. So we're really eager today to get a really insightful view from you on the best practice around caring for our little people. Can we start off first with boys? How do we care for our little boys' genitals?
Yeah, I think you're right, Freya. The most important thing is to be gentle. It's a very sensitive area in both boys and girls. I might start at the start because parents often say to me, what is the foreskin? When we talk about, do you pull the foreskin back, do you not? So the foreskin is the loose skin that covers the head or the glands of the penis. And the foreskin itself needs no special attention in infancy. It should be left alone. So a lot of people think they need to pull it back to wash. It will retract and separate on its own. So in most newborns, the foreskin can't be pulled back, can't be retracted. It usually separates over time, and by 1 year of age, some children's foreskin can be pulled back a little bit, and about 90% of foreskins are retractable, able to be pulled back by about 4 years of age. But the most important thing is that parents should not forcibly pull that foreskin back because it can actually get stuck, it can cause pain and can cause scarring. So you don't need to pull it back to wash it. And I think that's one of the most important things about boys' genitals.
Yes, and I was shocked to see that they get stiffies at that age. I was like, oh my gosh, a little baby has got a stiffy. What's going on? And then I was just like, this is normal. This is
very normal. You've gone there early, but very normal.
I know they just have a mind of their own, those things. What about baby girls? How are they different?
Yeah, so baby girls, once again, be sensitive. Just in terms of definitions, people get confused about the difference between what the vulva is and what the vagina is, and often they sort of interchange those two names. So the vulva are the genitals on the outside of the body, and the vagina is where the hole and the passage on the inside of the body that goes to the uterus. So people do use those names interchangeably, but when we're talking about caring for the girls' genitals, it's usually the vulval area that we are talking about. So be very gentle with vulvas. Don't overwash, don't overuse baby wipes. They can get quite red and irritated and inflamed. So usually just washing with gentle warm water is really important. And if your baby's sitting in wet or soiled nappies often, removing them quite quickly because that can cause quite a lot of skin irritation. It's skin, but it's particularly sensitive.
So beyond the day-to-day care of our little ones' genitals, we'd just like to go through some of the things that we can look out for that maybe aren't quite right, that might need some medical advice. And with little boys, can we talk first about Smegma?
Smegma? Yeah, it's got a SM. I was interested. I actually just asked my teenager whether they'd ever heard of the word smegma, and they haven't. But I think as a new parent, you often hear it and you freak out. And smegma is really normal. It's just white, yellow lumps that are under the foreskin. You don't need to worry about them. You don't need to try and get rid of them. So it's just a really funny name for many people, but it's actually not of any consequence.
And what about if the penis is slightly red? Do we worry about that?
Yeah, so both penises and vulval areas can get red due to inflammation and irritation. Often if the baby's been sitting in wet nappies or soiled nappies for a long time. So you want to actually give them a break from being in those wet nappies. Try and prevent that irritation, and often using a barrier cream, so a zinc type cream that we often use on the bottom, but you can actually use around that area as well, can be really helpful. So use the barrier cream, remove wet nappies, and just wash really gently that red area. If it's only a little bit red, it will often settle on its own. if it starts getting more extensive, so if the whole penis starts becoming red, inflamed, looks really irritable, you often will need to do something about that. And that's when we recommend seeing the doctor. You might use warm salt baths to try and calm it down. There are some topical ointments your doctor might prescribe, sometimes an antifungal cream if they think there might be a bit of thrush there. Very occasionally it can be so painful that boys need some pain relief, some paracetamol or ibuprofen. Interestingly, topical antibiotics don't work. So even though there's inflammation, it's not usually due to a bacterial infection.
Oh, interesting.
Lexi, I'm probably going to say this one wrong too. What about Balanitis?
Balanitis.
Balanitis.
So balanitis is what I've just mentioned. So it's that more extensive inflammation of the penis, and that's the one that will need a topical ointment, often a steroid cream, but a very mild dose one. So don't go and treat the genitals with steroid cream yourself. Always see the doctor first.
So Lexi, what about undescended testes?
So undescended testes and retractile testes are two things a lot of parents hear about and talk about, but they're actually a bit different. So undescended testes occurs in about 5% of male boys. Testes are usually in the scrotum. So if one or both testes don't move into the scrotum once they're developed, it's called undescended testes, or the fancy name's cryptorchidism. And as I mentioned, 5% of boys have undescended testes because when testes are formed in utero, they're formed inside the tummy in the abdomen, and they move down a tube called the inguinal canal into the scrotum, into the ball sac, and that usually happens in late pregnancy, about the 8th month of pregnancy. So when you're at your maternal child health nurse having your regular checks, they might notice that either one or both of the testes are not in the right place. It's most often congenital, so the boys are born with the testes that are not in the scrotum, they're usually still in the abdomen. Or it can happen with premature babies because, as I mentioned, it happens late in pregnancy, so there's not enough time for that movement to occur. There is also another condition, but much less common, called acquired undescended testes. So the testes were down at birth, but then they seem to disappear and not come back. And that's usually when the cord, the spermatic cord that is between that's usually when the cord doesn't grow at the same rate as the child. So it's short and the testes are pulled back up into the canal. So why does it matter? If the testes don't come down by 6 months of age, it is recommended that there is surgery, an orchidopexy, to bring those testes down and to fix them in place in the scrotum. So it does involve an operation, but it's a small one. And people often ask why. Why does it matter? And because we want to reduce the risk of health risks. We want to reduce the risk of testes that twist or torsion of the testes, the risk of hernia where loops of bowels come into the scrotum. And we also know that if the testes spend too much time in the abdomen, it's too hot up there. They actually need to be down in the scrotum where it's cooler, and it can increase the chance of infertility if they're not brought down. And there is also a very small risk of increased chance of testicular cancer. So if the testes are not able to be brought down into the scrotum, then surgery after 6 months is recommended.
And what about retractile testes?
Yeah, so retractile testes might appear like an undescended testes, but actually it's when one or both of the testes go up and down. So sometimes you'll notice it in the scrotum, but at other times it seems to have disappeared, and that's actually quite common. It often occurs when it's cold, so the testes sort of travels back up. There's a reflex that pulls it back up. But often if the child's a bit scared as well, and a health professional will try and see if we can feel the testes somewhere sitting in the groin or tummy, and we'll try and massage it back down and see if it does go into the scrotum. Because retractile testes we don't worry about in most cases, and in most cases they won't need surgery.
And how do you care for your little one if they have been circumcised?
Yeah, so circumcision is probably a lot less common nowadays than it was in previous days. But if circumcision is done, you will be given some instructions after the surgery on how to really gently care for the healing penis. But after it heals, it is treated like any other penis, but without a foreskin.
Let's move now to little girls, Lexi, and some of the potentially worrying things that you might see and the care of your little one's vagina and vulva. First of all, bloody discharge.
Yeah, so bloody discharge in a girl's vagina frightens us all as parents, but actually it's not that uncommon. So once again, the vulva is a really sensitive area, so it can bleed if there's been irritation, redness, inflammation. So really important to gently wash and clean that area. Probably the most common cause of bloody discharge is a condition called vulvovaginitis. So vulva and vagina, and itis means inflammation. So it's just inflammation of that area. And prepubertal girls have very thin lining of the vagina. And often it can get itchy and red, and you might even see discharge that can be quite smelly and can also bleed. So that is not an uncommon condition, and there are some good fact sheets about how to manage that. We often use vinegar baths, we give no nappy time, we use barrier cream, etc., and that usually settles down. If there's significant blood coming from the vagina, particularly through that hole, and it's happening all the time, clearly that's a different story, and then I would go and see emergency department.
What if your little one's complaining of vulva pain?
Yeah, so once again, if it's mild pain and there's a bit of inflammation, redness, eczema down there, you treat it, you're treating the skin. But there is a condition that you may or may not have heard of where the girls are asleep and they yell out at night with like quite excruciating pain. And there's been some research into it. One of the gynecologists at the hospital I work has done some research, and it's actually most likely related to worms, because we know worms come out the bottom and they can crawl and go into the vulva and the vaginal area, and it can cause excruciating nighttime pain. So very uncommon, but if there's significant pain, you want to think why.
And what about labial adhesions?
So labial adhesions, so labia is the name of the skin, the flap around the vaginal area. And there's two flaps either side of the opening of the vagina. And when these labia are joined together, it's called labial adhesions. So they're adhesive together. And actually that's also quite common. But often there'll be enough space for the urine still to come out. So we usually don't need to do anything. In the old days, many years ago, people used to try and divide these adhesions. I've even heard horrible stories about people trying to divide them with a pen.
Oh, gosh.
I would say if anyone's going to a health professional, you want to make sure it's a sterile procedure. But most of the time we do nothing because they separate on their own. As long as the baby can pass urine, we usually don't do anything about them. And you can gently massage them. There are some estrogen or other creams, some physical separation, as I mentioned. But we've found with those techniques, the adhesions often recur, so it just sticks together again. So as I said, if the baby could urinate without a problem, we usually just let it separate in time.
And so obviously as a baby, we're as parents and caregivers in control of like helping clean the area. But as they get bigger, how do you teach them to clean their own area?
So once again, I think with boys, it's important to recommend they don't, forcibly retract that foreskin, and they don't need to clean under it. It will come out. It will self-clean as well, but particularly if they're having a shower or a bath. Using gentle soap, not using too much bubble bath, particularly if the vaginal or vulval area or the boy's genital area is inflamed. So really it's just about being really gentle, warm water and soap, and just being particularly mindful of that area.
So Lexi, one last question. Why is it that boys play with their penis? It's like an
Very good
inbuilt
question.
toy, I get it, but, what is it that...
I'm not sure I should be the one answering this question. I actually haven't done my due diligence and asked all the boys and men in my life, but it's incredibly normal. Young boys and probably older boys frequently touch their penises, they play with it, and it's a normal part of development. It's exploration and it's okay. As you mentioned, young boys can get erections as well. So often if that is happening, I'll often say, maybe go in your room or do it somewhere privately. But really it's normal and we don't want to stop them exploring.
great, Lexi. Thank you so much for joining us today on the Expert Guide to Parenthood podcast.
Pleasure.
You've been listening to the Expert Guide to Parenthood podcast. Never forget, parents, you've got this.
Join a Parents You've Got This masterclass today to be prepared, excited and educated for pregnancy, birth, baby and parenthood. Visit www.parentsyouvegotthis.com.au and sign up for a masterclass today.